Hi, everyone. I'm Dr. Akilah. I'm a licensed psychologist in California and very excited to join Dr. Hill today to talk about perinatal mental health conditions, especially those conditions that happen in the postpartum period. We'll talk about the conditions, we'll talk about recovery, and I'll share more about my own perinatal journey. Join us.
Okay, welcome back, y'all, to Mental Health in Our Community. And I'm so excited to be here with Dr. Akilah Reynolds as we're going to talk postpartum disorders. What does treatment look like? Who can diagnose? The myths we have that keep us kind of I guess, feeling guilty about how we should be recovering. So I'm excited to take a deep dive. Before we get into it, I would like for Dr. Akilah to introduce herself. Please tell us who you are, your pronouns, if you feel comfortable doing so, where you trained, and what is your current specialty.
Sure. My name is Dr. Akilah. I am a licensed psychologist in California and in New York State. You want to talk about my training? Okay, it's a lot. So I got a 4-year undergraduate degree in psychology. I also minored in African American studies and I studied business management coursework. After that, I got a 2-year degree. It's a master's degree in psychological counseling from Teachers College, Columbia University. And then I said, you know what, let's keep going. That was my original plan. I needed to keep thinking when I was in my master's program before I went, I said, no matter what, you are going to get a doctoral degree because I knew it was going to be hard. So that's
Mm.
where I met Dr. LaWanda Hill. I moved to Texas and I got a doctoral degree in counseling psychology from the University of Houston. That took me 5 years.
Mhm.
And what people, just to make sure people kind of understand the process, the first 4 years I spent in Houston doing coursework, working on research, and doing clinical training in different practicums. And then that last year, I moved back to California. I'm a California girl. And I did my 1-year pre-doctoral internship at an intensive community mental health outpatient clinic. At that time, I was specializing in working with children. So I was working with kids in lots of different settings from school age kids around, kindergarten, first grade, all the way up to high school. I work with kids in schools and juvenile probation and hospitals and mental health clinics, all of those different sites. And after I got my doctoral degree, after that, I did a 2-year postdoctoral internship at Children's Hospital in Los Angeles. And there I specialized in adolescent and young adult medicine. I worked with adolescents and teens in integrative primary care, also in an outpatient clinic. I worked with teens who had dual diagnoses, who are diagnosed with a mental health condition as well as a developmental condition, and
Mm.
also worked with oh yeah, I forgot about this. I worked with pregnant teenagers and teen moms at a research project on that, as well as worked with young folks who were experiencing homelessness or who are unhoused in Hollywood.
Love it. Extensive training, very much so well qualified. So total, what is that, about 11 years, 12?
13
13
years from
years?
undergraduate all the way to finishing fellowship. And
Mm.
in that time, I got licensed as a psychologist in California. I do have to say, I was trained as a child psychologist, but in the last 5 years, I've made that shift to working with parents and particularly working with moms who are in the perinatal mental health phase or the perinatal phase, but I'm working with them on as they experience mental health conditions.
Love it. So we are definitely in good company. Very well. I love the expertise. And I really can't wait to hear your perspective, having worked with children, transition to perinatal moms, just working with adults in general. And so I think that you, to me, you have the spectrum of expertise to be able to weigh in, which is why I wanted to talk with you specifically on this condition. And so we've been part of this mental health series, Mental Health in Our Community. And what I've been wanting to do is just kind of bring general 101 like course to each condition. And this condition is postpartum conditions. I think when I speak as though people have no idea of what it is, could they be suffering from it potentially? But I like to make it really plain. So let's just start with postpartum in general. When we say postpartum, you mentioned working with perinatal, which I know is different from postpartum, but they are connected. So when you say perinatal, talk to us about that and then tell me how that relates and is different from postpartum.
Sure. So a lot of times in like out there in the media and society, we hear postpartum, and a lot of people are talking about postpartum depression, but the term postpartum actually just refers to the phase after childbirth, where a pregnant or previously pregnant person, so someone who's given birth, a mother, has delivered their child. And in that first several weeks to months, up to a year after delivering a child, we do know that some research and just differences in how people recover, that sometimes that recovery may even take longer than that. When I say perinatal, I'm referring to the period of pregnancy through childbirth and postpartum. So that's the
Mm,
full cycle of sort of
wow.
becoming a parent and, preparing to have a child as you are pregnant and dealing with all of those different changes that happen before birth. And then there are so many different changes in the postpartum period where people are
Mm.
recovering after this huge, big deal of giving birth to a child.
Mhm. This is why I love talking with you about this because that was such a significant shift for me. And not a mom, I have intentions to be, plans to be, but having gone through that experience. And so you being a licensed psychologist, but also being a mom, the way you framed it, when I've had moms who have come back to me, my clients, I can't say how many I have now, but I have a few clients who are expecting. I
Oh, I
gotta
love
say,
that.
I was one of the first people to see the pregnancy test aside from their partners, so it's super exciting, to be a part of their journey. But so I've always been a part of their treatment, obviously. But then when they experience postpartum and now they're coming back with these different conditions, the way in which I've consulted with Dr. Akilah was to get her expertise on how can I add to, the treatment plan that was already existing based on these conditions. And what you shared with me that I think was super helpful was that this is a significant period of time, right? Perinatal is from the pregnancy, throughout the pregnancy, postpartum. And like you said, it could be up to 2 to 3 years or longer. It just depends on how long it takes our body to recover. So I want you to talk to us about that specifically because I think that moms make it look so easy that people don't really understand that this is a significant shift in the body, in adaptation, and all of the things. So when you say this, talk to me more about what you mean when you say like, wow, this big thing and recover, and why recovery and framing it that way is so important.
I think, yeah, our society forces mothers to make it look like it's easy. I think we live in a society where women are expected and people who give birth are expected to go to work, even if they're pregnant, even if they're struggling. You have to really defend not working during the
Mm,
pregnancy phase and also after you get not everyone gets time in the postpartum period to really recover from their job. The changes are stark. There
mm,
are hormonal changes and shifts for someone who are going to have a child. And if we think about some of the possible, what do you call those? Risks that of pregnancy, that what happens to people, mental health conditions are actually sort of at the top of the list. They're one of
uh-huh,
the risks of pregnancy that we don't always think about. Of course, we have to think about the actual life of a mother. We hear a lot about
mhm,
maternal mental health and maternal death, as well as
mhm,
infant mortality.
mm,
But one of the causes of maternal death is also suicide, and that's like a mental health condition. We don't always think about that. And mental health conditions are a real risk of the perinatal period.
mm,
I like to say that it's not just a physical change as well, but you're going through mental and emotional shifts, as well as for some people, just spiritual and social
mm,
emotional shifts.
mm,
One thing when I'm working with folks and that I was surprised about, even in my own pregnancy and postpartum journey, was just how isolated that a lot of mothers tell me they feel
mm,
during the pregnancy period, but especially in the postpartum period. Those are all
mm.
things that I wasn't expecting, but as I work with more and more moms, these are things that I'm hearing.
What is that about? So when you talk about that isolation, well, first let me go back. So when we say one of the risks that we've talked about the risk that's been part of one of the episodes of this series of postpartum disorders, which we're going to talk more about, is mental health conditions. That to me is shifting, is mind changing because I don't think we associate that. But then when we talk about why, because the hormonal shifts, the environmental shifts, the social shifts, the isolation, it makes me understand why, in addition to just previous pre-existing risks like mental health conditions or
Yes.
history of postpartum, or history of family, or financial stressors, or
Yes,
work
all of those
conflict,
things.
relationships. All of these things don't stop because we have pregnancy, and that heightens the risk of these postpartum conditions. So before I get into it, because I'm getting ahead of myself and talking about the isolation and all the things, talk to me now about postpartum conditions. Now that we know what perinatal is, and now we know that it takes the body time to recover, talk to me about the postpartum conditions that are these mental health challenges that's associated with pregnancy or post pregnancy.
For sure. So you can get a mental health condition during any phase of the perinatal period. The prenatal
Mm,
period, which is the term that we use to describe the time prior to birth, you can get a mental health condition. And then also we hear a lot about postpartum conditions, and you can get them after birth. For many people, you may have heard about the baby blues. This is not a mental health condition, but it's something that up to maybe 60 to 80% of women kind of the studies kind of range, but 60 to 80% of folks who give birth have what we experience as the baby blues. That's from about maybe a few days after birth, 2 days or so, up until about 2 weeks after birth. And it just is a time period where women may feel a little bit more tearful or maybe more reactive, probably really just exhausted. So this gives us space to just to acknowledge that after you give birth, you might have some psychological, emotional, mental, physical changes. And then we have to also make sure we denote and sort of distinguish that from an actual depressive disorder.
mm,
So postpartum depression is depression that occurs in the postpartum period after you give birth, although some women experience depressive symptoms prenatal while they are pregnant.
mm,
Um, when you're thinking about is this postpartum depression or the baby blues, a time factor is a piece of this. So if it's past, a couple of weeks after, it's probably more so depression. But if the depression, but also like the duration of it. So you want to see depressive symptoms for at least 2 weeks or more. And then the symptoms are a lot more intense and enduring. So for 2 weeks or more is someone feeling sad, down, depressed, basically all day, almost every day. Is someone experiencing a lot of irritability, having shifts in sleep. That's a hard one because many women experience shifts in sleep.
It's like
Which
part of
is
the journey.
I know, which is sometimes maybe it's why it's hard to distinguish because we know that sleep problems are common for folks who are in the postpartum period, but that's also an indicator of depression. Tearfulness, crying spells, also indicative of depression. But you just kind of want to look at the intensity of the symptoms to distinguish it from the baby blues and the duration and when it occurs.
So that's good because when I introduced this series, going back to a pop quiz, y'all, when I introduced this series, I told the audience that there's five key questions you want to ask yourself when determining into any mental health condition, and that's the symptom, the number of symptoms, the frequency by which those symptoms come, the duration, and the interruption. And so when
Hmm.
you're talking about baby blues, you're talking about baby blues. I'm sorry, versus postpartum depression is exactly what we've talked about. What are the symptoms? How many? How long have they been there? How frequent, or what's been, how this is the frequency in this particular instance is it is occurring in the postpartum, or could be prenatal, perinatal phase, at some point in the perinatal phase. And then the disruption, you talk about intensity and difficulty getting out of bed, difficulty caring for yourself, difficulty even connecting with the baby,
Yes.
guilt, worthlessness, feeling concerned about the future, all of those things, and maybe even suicidality, as we talked about. This is now when we've risen to the level of a mental health condition. In this instance, we're talking postpartum depression.
Yeah.
Right. Okay. Now, talk to us about postpartum anxiety. Or is that like a sub qualifier within depression? Or is postpartum anxiety completely separate, a separate condition?
Yes. So, anxiety and depression highly comorbid for many people, even in the postpartum period. But someone can be diagnosed with anxiety in the postpartum period as a due to a condition of pregnancy. It's
Mm,
pretty. Well, I'm trying to think of trying to pull off top of my head like how common it is. Let me sort of get some data for you in terms of those numbers because you might
okay.
be surprised. For the prenatal period, about 15% of mothers, at least in one study, had exhibited signs of postpartum anxiety, prenatal anxiety before pregnancy. And then about 18 to 20% in the postpartum period, depending on what study you look at. So
Mm,
feeling anxious, worried, nervous, particularly around your child, just
mhm,
restlessness, anxious. The typical
Mm,
telltale symptoms of anxiety you will see, but it is happening in the postpartum period. It is intense.
mm,
I also want to note, because I think postpartum OCD is a huge thing that we may
mm,
not always give a lot of attention to,
mm,
but for many people, they might feel anxious and also have these intrusive thoughts.
mhm,
Intrusive thoughts are unwanted, undesirable thoughts, and for a lot of women, they may actually be about harm to your child, which can be
mm,
very, very scary. Intrusive thoughts overall are actually pretty common actually for folks in society, and somewhat common for people are I won't say common, but just they're not common. Like women experience these intrusive thoughts about contamination, about
mm,
harm to their child, and
mm,
that's where it can get scary, and we wanna distinguish that from something called postpartum psychosis. I'll put a pin in the postpartum psychosis, but I do just wanna say, if someone is experiencing, like, OCD symptoms, usually what distinguishes it from a safety issue is that women know that they don't like the thoughts. They don't
mm,
want the thoughts. They know that there's something that doesn't
mm,
feel right about these thoughts, and for most or many people who experience these OCD thoughts in the postpartum phase, they have the thought and then they want to do something. They have some sort of compulsion to make sure the thought doesn't happen.
mm. Okay, so we have this is really good. We have baby blues, we have postpartum depression, we have postpartum anxiety that you talked about, that restlessness, that fear, that worry, that feeling that
Irritability.
irritability. Now we're getting to postpartum OCD, which is OCD in of itself is around obsessiveness and compulsiveness, and that's specifically around the kid, the safety of the kid, maybe wanting to harm the kid, unwanted. There's a level of insight that I'm hearing though, and that
Yes.
the moms know that this is problematic. Distinguished from now, let's introduce postpartum psychosis. So when we talk about postpartum psychosis, my understanding is that there is not awareness of
Yes.
the psychosis. So
Exactly.
talk to us about what that is, those symptoms, and how it differs, I'm sorry, from postpartum OCD.
Yeah, so the difference is usually women don't have that level of insight, and they may feel like compelled to act on the thoughts because they don't see the thoughts as bad.
Right,
They
because they
don't
kind
see
of
the
feel like delusions, more like
Yeah, it's
delusions.
more they're not kind of in touch with reality in that way. There's these delusions are fixed false beliefs. So a woman
Mhm,
may have some sort of belief about her child, and the thoughts may be um about harm to that child, and it may actually feel while she's in that state, it might like the thoughts may be comforting because the thoughts are telling her to act in a way that may be harmful to her child. If someone has postpartum psychosis, it is a mental health emergency and you want to get immediate support and help. It can be really scary, and sometimes women do follow through with the thoughts. I don't want to scare anyone, because what we see largely is that people do not follow through with thoughts to hurt themselves or their child, but it does happen.
mhm.
And we want to get someone immediate support, immediate care to make sure that they get the treatment that they need, that provides them with the support to make sure that they are healthy, they are safe, and so are their baby.
Okay. So I think you just really laid that out so beautifully, in the sense that the way in which you distinguish the disorders. And so just to reiterate, with postpartum psychosis, it's out of touch with reality, right? And so that would include the moms being out of touch with reality, such that they are experiencing hallucinations, which is seeing, feeling, hearing things that aren't there,
Mhm.
delusions, like you said, which are fixed false beliefs.
Their thoughts,
Um,
speech may be disorganized.
okay. What else when we talk about those psychotic symptoms?
I'm trying to think. So we went through delusions, which are fixed false belief. It may be about the child that something, is demonic about the child, or some or
Mhm.
thoughts to that sort of degree. We talked about disorganized speech, disorganized thoughts. I'm trying to think of that's what comes to mind right
Okay,
now.
those are the major clusters. It feels
Mhm.
like that. It feels like it's delusions, hallucinations, wanting to harm the baby, just needing immediate psychiatric care, not being in touch with reality. So I guess I'm listening to this, right? And we have to name what I think the elephant in the room, or at least for me, I'm like, this
This
shit
is
sounds
scary.
scary as
I know.
hell.
That's why I'm over here like, no, I don't want to scare people
But
because
it's
it's not.
that's the whole point of the series, is that we want people to be informed so that they can feel
Yes.
empowered, right? So because let me just say this, and you correct me if I'm wrong. Postpartum psychosis is not, it's experience, it happens, but I don't think that that's as most common as postpartum
Yes,
depression or
exactly.
anxiety or OCD. So is that what I'm hearing?
Yes, 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 yes. I would say you're probably going to see more depression, anxiety, perhaps OCD type symptoms more than you would see psychosis. It just does happen, and
Mhm,
mostly people don't follow through with thoughts, but it does happen, and so it's just we want to make sure that folks know that. The other thing I want to know is that some of the research says that for training for folks in the medical field, that it's important for us to be able to distinguish, for example, OCD thoughts versus psychosis, because if sometimes people may
mhm,
misperceive a thought and
mhm,
may think that a woman is in a is having a psychotic episode, but actually just they're just having intrusive thoughts. And so
mhm,
really not being afraid to ask these questions as providers, and for us also as women, as mothers, as people who are giving birth, and also for partners and families to ask these questions to make sure that we're able to distinguish kind of what's going on, and to know that we need to seek support if someone is not able to distinguish the thought, that from a behavior. I will say a thought is a thought, and that's one thing that I really like to hone in for people,
mm,
especially when they're experiencing OCD intrusive thoughts. A thought is a thought. It does not mean that it's behavior. But for
mhm,
folks who may want to act on those thoughts or can't distinguish that it is a thought, that's when
mhm.
that's when our alarm bells go off, and they just need a little bit more care, a lot more
There
care.
we go. I love that. I love that because that's really important to note as people are listening and maybe even experiencing some of these symptoms to help them distinguish. And so I guess I'm wondering, okay, as a person who desires to be a mom and understand that, mental health condition could be a complication, is what I think the literature
Yes, that was the word I was searching
says.
for. Thank you.
Mental health conditions or mental health symptoms like the baby blues, but mental health conditions like postpartum depression, postpartum anxiety, postpartum psychosis could be a complication of pregnancy. What are the risk factors? Can you list some of the risk factors that could contribute to this? I know, again, that postpartum psychosis is not as prevalent as these other mental health conditions. And I do think that there are some other risk factors that maybe compound the likelihood of that happening that's
Yeah,
different from others. And so, can you talk to us about the general risk factors and maybe even want risk factors specific to those conditions?
sure. I think previous psychiatric conditions are a big risk factor for some of these other conditions.
Okay.
So if you've had some sort of psychiatric condition before, then it is possible that could be a huge stressor and exacerbate those symptoms.
Mm,
For specifically to psychosis, we know that for women, so we talked about unipolar depression, but also there's bipolar depression. And
mm,
so for folks who experience manic symptoms, I don't want to give you the wrong stats, but I think there's about 20 to 30% of people who experience bipolar depression and have a manic episode go on to
mm,
have experience psychotic symptoms. So
mm,
actually, if a woman is diagnosed with bipolar disorder, bipolar depression, meaning they've had a manic episode at some point in their lifetime, then that is a risk factor for experience psychosis and something that you want to be mindful for. Going off of your psychiatric medication during pregnancy, which some people do, also a
mm,
risk factor, especially when you're thinking about managing bipolar disorder, managing symptoms that are related to psychosis. So I would recommend that if you are on psychiatric medication or you have a psychiatric condition prior to pregnancy, that you really stay in contact with your provider and develop a treatment plan that works for you. Now, what I hear from many folks is they don't want to take medication because they have a fear of harming their child with the medication.
mm,
In my communications with prescribers, psychiatrists, what they've shared with me is that there's a risk for all of these things. So
mhm,
there's a risk to taking medication, there's a risk not to. And when
mhm,
you're making these decisions with your provider, you have to kind of weigh out those risks, and it's an individual it's an individual treatment plan that you make in consultation with your
mm.
healthcare provider.
Okay, so I'm hearing some of the risk factors that are more biological in nature, like like a history of these psychiatric conditions, even medication, right? But now, can we talk about some of the psychosocial risk
Yeah.
factors?
The
Like the
things that
everyday
you
things.
Yeah, the
Go
things that you
ahead.
had mentioned earlier, those are all risk factors. And it's really challenging. A lot of my conversations with people I work with are really acknowledging that our society, the one that, like, especially American culture, is not supportive of families. It is not
Mm,
supportive of folks who are
mm,
pregnant and having children. And so
mm,
I try to lay blame on what I feel the blame rightfully goes, which is the way that our society is set up.
mm,
Spoke about things like finances, like
mhm,
work. These are things
mhm,
that don't change. Sometimes family stressors,
mhm,
moving, relationship problems or issues.
The
These
economy, the
The
political
economy, the
climate.
political political environment, all of the things that we are seeing, social, economic, political issues, these all impact pregnant people and mothers who are pregnant or who have given birth. I
Mhm.
would also like to speak to the fact that we need, this is my advocacy part.
Go ahead, advocate, girl. Advocate, Dr. Akilah.
We we need maternity, paternity leave. We need family leave across the
Mm,
United States, not
mm,
just for the person who has given birth or the mother, but also paternity leave. What we know and what we're not always talking about is that men and the non-birthing parent also about 10% develop mental health conditions in the postpartum phase or the perinatal phase.
mm,
So they are also at risk, and that may not be something that we talk about. But when you have a partner who has a mental health condition as well, that also compounds. And
mm,
so if your partner who's given birth has a
mm,
condition,
mm,
the person who hasn't given birth, may also be susceptible and have a condition as well. And if both of you all are struggling, and rightfully so, because pregnancy, postpartum is hard, especially with all the things we talked about, we need people to be able to have paid time off to
mm,
recover. Recovery is huge.
mm,
And when you have to go right back to work, or if you only have 6 weeks, which is the standard 6 week disability leave that you get in California for a vaginal delivery, and 8 weeks for a C-section.
mm,
A C-section is a major surgery.
mhm, mhm,
It's I can't think of another surgery where you get, like, actually, you go through this surgery and then you're handed, a 7, 8 pound baby perhaps, and then
mm,
expected to lift that baby and to go upstairs and to do whatever you need to do and take care of yourself 2 days later after you get let go, or 3 days later. I don't actually know how long you get to stay in the hospital, but maybe for a couple of days, and then go
mm.
home and are expected to care for yourself and your child.
Well, now we're cooking. Now we're
Okay.
cooking. We're getting ready to get into the recovery. I want to actually break this episode up in two different ones so people can have
Okay.
a moment to take this all in, and then we're gonna come right back to recovery. So y'all stay tuned with this episode of mental health in our community where we're talking about postpartum conditions. We're gonna come right back with Dr. Akilah and talk about recovery. We're gonna talk about recovery myths. We're gonna talk about who can diagnose, because this episode is not for self-diagnosis. Okay. And then what treatment options look like. So y'all stay tuned.